So today we are going to study about the lens. Why the lens is more important? Because we all know the pathology, which is the cataract, which comes under the lens. Okay. So first we are going to study about the anatomy of the lens. Okay. So what is the shape of the lens? The shape of the lens is a biconvex. So it is a biconvex in shape. So this is the shape and anteriorly, and this is the posterior side. So while we are looking at the convex, here the anterior side it is less convex than the posterior side. So the posterior side it's convex, it is more convex. Why it is important means while we are taking the radius of curvature, at the anterior side the radius of curvature will be 10 millimeter and the posterior side it will be 6 millimeter. So since at the posterior side it is more convex, the radius of curvature will be less, like 6 millimeter only. And this one is the diameter of the lens, which is about 10 millimeter. Okay. Next, where the lens is situated. It is situated in between the anterior segment and the posterior segment in the patellar fossa. That is the space where the lens is situated. And the third point is, what is the function of the lens? The function of the lens is converging the light. Mainly two parts of the eyes will help in converging the light. First one is the lens and second one is the cornea. And the converging power of the lens is about 16 diopter to the 19 plus 19 diopter. So why this variable? Why that power it is in a variable condition like 16 to 19? Why means here the variable, that is the converging of the light, that depends mainly on the accommodation power of the eyes. Okay. So that is why it is in a variable condition, the power of the lens, the converging power of the lens. And the next, for the fourth point is, what is the color of the lens? We all know it is transparent. Okay. It is what? Transparent. And the fifth point, what is the blood supply of the lens? We know it is transparent, so it is avascular. It doesn't have any blood supply. The lens doesn't have any blood supply because we know it is a transparent organ or transparent part of the eyes, and we need the lens, the light to converge on the lens. Therefore, the blood supply, if there is no blood supply or anything, the color of the lens will change. So it should be transparent and there is no blood supply and there is also no nerve supply too. Okay, because mainly the lens will change its means the performance or the function of the lens will be mainly based on the accommodation. Okay, so there is no nerve supply. Next is the refractive index. The refractive index means here the refractive index, based on the refractive index, the lens is divided into an outer part and an inner part. Inner part, that is the center part, which is more denser, therefore the refractive index is about 14.606. Okay, and the outer part it is about 13.9. So that is about the refractive index. So these are the basic things we should know about the lens. The second part is, what are the main attachments of the lens? So this one is a lens. So we can see there are so many attachments. The first attachment is this ligament. What is the ligament here? This ligament is known as the Weygard's ligament. Okay, Weygard's ligament helps to connect the lens with the vitreous. This is the vitreous humor, and the attachment of the lens with the vitreous face is through this ligament, which is the Weygard's ligament. Okay, and the second one is the Berger's space. This one is the Berger's space. The Berger's space, it is a space that is seen posterior to the lens and anterior to the vitreous humor. That is the Berger's space. Okay, and second one is a canal. So the third one is a canal, which is the Cloquot's canal. What do you mean by Cloquot's canal? Means it is a canal which connects the optic disc and the lens posteriorly to the lens, and anteriorly it connects the optic disc. Okay, what is the importance of this Cloquot's canal? Means it is a space where the hyaloid artery lies. Okay, we know that the lens, which is a part which is avascular, so the blood supply is not needed after the birth for the lens, but at the development, that is before the birth, there occurs the development of the lens. So at that period we need to supply blood to the lens. At that time it is supplied by the hyaloid artery, which is present at the space which is the Cloquot's canal. Okay, and at the 8th month of gestation this will disappear. Okay, that's it. And sometimes the remnants of this hyaloid artery will be present after the birth, and that can be called as Mutten-Darv's dots or Burmeister's backline. Okay, bye.